Sandy Rey.
I'm Alexa Lopez.
I'm Elizabeth Leah.
I'm Andrea Lopez.
I'm Margaret.
And we're the Band-Aids. We're here interviewing Esmer Adame, a PTA for our career, which is PTA. She's been a PTA for 3.5 years.
How did you decide to enter the field?
Actually, I went back to school after like 10 years. Went back to college, school in the medical field. And once I was in there, I heard about physical therapy and all of the different types of facilities and like the high rate of employment. So that's how I was able to and I liked it more. It's more of, I've always been very athletic, so about that, I loved everything about it.
What kind of education and training do you have?
Well, I do have an associate's degree. Primarily, I went ahead and completed that, and then with interdisciplinary studies, and then I was accepted into the physical therapy assistant program. And prior to that, I have a certification on medical office specialist, and also in word processing clerk. Yeah.
So, what are your responsibilities on the job?
My responsibilities as a physical therapist assistant is everything that a physical therapist assistant and a physical therapist does, except for evaluating patients. Basically, where I work is an outpatient clinic, so the physical therapist, she's the one who comes and does the evaluation on the patient, and she creates a plan of care, which is like a flow sheet that has all the exercises for that specific patient for her diagnosis. And every patient is different and unique. So I am basically in charge of making sure that the patient does everything correctly, correct form. I also have assistants, which are techs or aides is what they're being called, and they do a lot of the physical therapeutic exercises with them. I do a lot of hands-on and manuals to increase like their passive range of motion, increase their strength, decrease their pain. So I just oversee and supervise my assistants as well as hands-on with the patients. So it's a lot of responsibility too.
How and by whom are work decisions made that affect you?
Okay, we're definitely the owners and physical therapists, sometimes administration, the human resources department. You know, we work at a gym. I work in a gym as a physical therapist assistant, but anything that the administration or human resources have does affect me and treating patients. For instance, sometimes they say, okay, we're gonna have a student, or they're gonna be observing, and we're in our little routine, or sometimes we have new employees that we have to train, so it kind of distracts our little flow by having to train certain people or do certain things, little things like that. Sometimes our clinic has 10 clinics in the valley, so sometimes somebody's out, and so I'll have to go and cover somewhere else at another clinic. Just little things like that.
The owners aren't the physical therapists?
Yes. Well, he is one person. He's a physical therapist, but he doesn't treat patients unless he really has to, which is hardly ever, because he has physical therapists at each clinic. So he hires PTs.
What do you like most about your job, and what do you like least?
Well, the thing I like the most is they're my patients. It's very rewarding. When a patient is not able to stand up for 10 seconds, and yet at the end of their treatment, months later, they're able to ambulate with a walker out of the parallel bars and on their own. That's like just the best feeling. And the least is just the fact that patients sometimes are so frustrated that they don't believe themselves that they're going to get better. So that's kind of dampers my my emotions a little bit. Like, I have to keep motivating them, but they cry about how it hurts or how they're in pain, which is, in reality, they're frustrated, and I don't blame them. They're in pain. So that's kind of like the least thing that I wish was different. It's just not 100%. Not all of them are like that. But then you have these elderly patients that they feel like they're never going to get any better, and it's kind of difficult to change that mindset. But you just have to keep at it.
Okay. How much influence do you have over decisions that affect you?
Okay, well, I work in an outpatient facility. So right now my hours are basically set all year long. And where I am at is they're very flexible, so I always get what I want.
What do you find most difficult about your job?
But my job, it's basically seeing the patients in pain and how frustrating they are. That's just something that you're kind of get immune to because you see it every day, all day. But at the same time, it's part of your career. Is motivating these patients that are always in pain and they're frustrated. Although it's very rewarding at the end when they see, improvement and they're able to do things that they were not able to do. But that's one of the toughest things is having to listen to them vent. So
What would you change about the job if you could change anything?
about my job or about right now I'm very grateful and I'm happy where I'm at. I work from 8 to 6 during the week, and on Fridays I'm out at 12. So tomorrow I'm off because it's a holiday. We have great benefits, so right now I don't have anything to complain about other than more space. I think we need more space because we have a lot of patients. But yeah, right now at that job, that's about it.
What sort of person do you have to be really good at this job?
There's a little bit of everything. I've seen where there's PTAs, other PTAs who are very good hands-on, but they have no social skills. So you also want to have, as far as know what the contraindications are for the patient. You also have to kind of be, a people's person because you want to get to know the person. You're going to be treating them 3 to 5 days, 3 days out of the week, or 5 days out of the week, or depending on where you work. So you do build a little bond with this person. They tell you, they talk to you about things, and as a professional, you have to know where that personal line is. You have to be ethical and careful about what you say. But you do build a bond with these people, so you have to have people skills. You have to be ethical, professional, and basically I think that that's the most important, is just to be professional and ethical and have that social skill where you actually have a conversation with a patient that you're treating for 30 minutes. I've seen where they're being treated and there's not a sentence that comes out of either one of them, and it's kind of, it's not very nice sometimes because they want to hear motivation. They want to know that they're going to get better, so that always helps.
Is there any specific advice you would give to a person entering this field?
Well, just depends. When you're in school as a physical therapist assistant student, your life is all 100% being a student. It's very competitive, so try your best to always, be on time and try and do 100% at every single class, every single grade. Pay attention when you're in the program. It's very difficult. I've seen a lot of people and stress and cry and but at the end it's all rewarding. You just have to find the balance. If you have your family and your friends, if they understand and love you, they will know you're not going to any parties, you're not going to be at the barbecues, you're not going to the quinceañera, and it's all for your own success. So you just have to be selfish in that way and kind of make sure that you understand that you have, that you have a goal and that nothing is going to distract you, because it's very difficult when you're in a little bubble having to do what you have to do because you want to, become a physical therapist assistant. So that's just something that I feel is very important, that you already know as of now, once you're in the program or, going towards a PTA, that it's going to be, it's going to be up and down. There's going to be little challenges there. So just be prepared for that.
What are some of your day-to-day activities?
Okay, as a physical therapist assistant in the outpatient clinic, because that varies. Where I am at, the first thing I do is I have to have my coffee. I have to have coffee. Just kidding. But one of my daily activities, I have to always oversee the physical therapist assistants, which are like aides or the techs. I oversee all the patients. I bring in the patient. I get their chart, check their diagnosis, bring them in, ask how they're doing. We treat them by exercises. We also use electrical stimulation. We use NMES for strengthening. We use some hot packs, which is part of modalities. We also do TheraBands, that's for intensity, for the strengthening. We do ultrasounds. We drape the patients. We position the patient according to whatever treatment they're going to be doing. And always just be correcting the patient's positioning, because if they're supposed to be doing a squat and they're doing something that they think is a squat, just always correcting their form. So basically exercises and modalities.
Where do you expect to go from here?
Oh, I'm comfortable where I am right now as a physical therapist assistant. I've been a therapist assistant for 3.5 years. So I'm just very happy, and right now I'm just concentrating on enjoying being a PTA. I've looked into the bridging program for PT, but right now I'm just satisfied with treating patients at the moment.
Is there much advancement you can do for as a PTA? Like,
No. The only thing is, there is, because you can take continuing education courses, so you can get certified in different things. So like if you want to do kinesiotaping, or if you want to do more of massage, they teach you. Because when you go to PTA school, it's kind of like just a little bit like they teach you massage, but just like the basic. It's not like you went to school just for massage. You know what I mean? So like going as a massage therapist, you go to school for 9 months, and all they teach you is all this massage. So we don't do 9 months of pure massages. Like we tap into it and we learn, but it's not like the whole intense. But if you go and get certified, you can into massages, or which is called soft tissue mobilization. You can do kinesiotaping. You can do like Parkinson's, or you can do anything that you want to certify. Like you want to get better at, you can have those certifications under your belt. And so whenever you go to an interview, you want to go work at a hospital or with your patients, that will help you, because you have these certifications. Yeah, like if you want to just concentrate more on neuro patients, then you get certified in anything to do with neurology, like cerebral palsy or Parkinson's disease or stroke. Yeah, or cardiac. Yeah, so you can. Right now, all I do is orthopedic, so it's patients who are basically in and out of surgery. So I treat all. That's most of it.